Trick-or-treating is back, but health experts still want families to be COVID conscious. Naomi Ruckham explains how to have a fun but safe Halloween this year.
6-year-old Talia Chang can't wait for Halloween.
Lots of Skittles and chocolate.
But she knows her peacock costume will have a very important accessory.
Our daughter will still wear a mask when she's trick-or-treating, and we will as well.
Health officials say it's safe for children to enjoy Halloween this year if simple COVID precautions are in place. Dr. Mercedes Carnathon with Northwestern Medicine says everyone should mask up, especially if you welcome trick-or-treaters at the door.
There's no way to predict the density of children who are going to come together, and there's no way to know which households they're approaching, whether or not those adults are vaccinated or unvaccinated.
We know the virus is more likely to spread inside, so experts say it's best to say boo to indoor Halloween parties and celebrate outdoors, especially with younger kids who can't be fully vaccinated by the holiday.
It is not safe to hold an indoor party with a large number of children unmasked. I think not offering food and drink indoors is critically important to keep any type of an indoor gathering safe.
The American Academy of Pediatrics recommends limiting trick-or-treating to small groups, waiting your turn to avoid large clusters while trick-or-treating, and practicing good hand hygiene.
Definitely wash hands, use hand sanitizer as much as possible.
Like last year, Talia's family is keeping it safe with a table of treats in the driveway. And this little peacock knows what's best.
I wear my mask to be safe,
so it can be a sweet Halloween for everyone. Naomi Ruckham, CBS News, New York.
The American Academy of Pediatrics also reminds that costume masks are not a substitute for a face covering to prevent the spread of the coronavirus. For years, we've heard warnings to parents about the possibility of people tampering with their kids' Halloween candy, from razor blades to needles and even marijuana-laced candy now. The stories are scary, but is there any truth to these claims? Let's verify right now. The National Confectioners Association ran a Halloween candy hotline from 1982 till 2012. That was for police and poison control centers to report contaminated candy across the country. In an email to verify, an NCA spokesperson confirmed that they no longer track these reports, but, quote, agree anecdotally that these are typically isolated, rare, false reports and or hoaxes, end quote. So we can verify that legitimate reports of contaminated Halloween candy are not common. According to the National Safety Council, it's cars, not candy, that pose the biggest threat to kids on Halloween. Their data indicates children are more than twice as likely to be hit or killed by a car on Halloween than any day of the year, other day of the year. So if you are driving this Halloween, please be careful. Governor Asa Hutchinson praising the progress Arkansas has made in lowering COVID cases and hospitalizations over the past month. Let's show you those numbers right now. The governor says a month ago our active cases were at 11,000. Our positivity rate was over 9%. Right now we have fewer than 5,000 active cases and our positivity rate has dropped to 6%. 517 new cases of the virus were reported yesterday. 348 Arkansans are fighting COVID in the hospital this afternoon, and unfortunately 19 more people have died from COVID. 3 months ago, we shared a mother's powerful plea begging people to get vaccinated as she watched her teenage son fight for his life from a hospital bed. After 3 months battling COVID-19, her child is finally home. THV 11's Mercedes McKay shows us what the family's life looks like now as the long recovery continues.
I'm very happy to be here. I did not think that we were going to be here. He was so critical for so long. I did not think we were going to be here.
Angela Morris holds her son's hand tight as they sit side by side in his room, a place they haven't been in months.
This is nowhere what I imagined. I read the news too, and all the people on COVID and ventilators, and I would have just never imagined this was going to be our life.
They called the hospital home for the past 16 weeks as Alex battled COVID-19, spending most of his time on a ventilator, the machine breathing for him.
It was a lot of stress, a lot of confusion. I was overstimulated and overwhelmed.
It was the little victories like these, his first day without oxygen and his first time sitting up alone, that got Angela through. And just days ago, the family got the news they had been waiting for. Alex could finally go home. But for Angela, that came with a mix of emotions.
I was very happy, but I was also very nervous because his care is all up to me now.
At least 8 hours of Alex's week now involves physical, occupational, and speech therapy as the 13-year-old slowly learns to breathe, walk, and talk again. Dr. Rick Barr with Arkansas Children's says all of this is the body healing itself.
There are a lot of things that a child has to go through to recover from any type of critical illness, let alone COVID.
For a child that was on a ventilator as long as Alex was, Barr says the lungs have to learn to work on their own.
I think the short answer, it just takes time. There's no magic bullet. There's no, necessary treatment.
Barr says with a child that was in such critical care, there's no telling when Alex will be himself again. All he knows is that it will be a long road.
I wish we had a different answer that we could just fix this, but it just takes time and a lot of good medical care and attention and support by the family.
While Angela is back home treasuring every moment with her son.
Him talking and him smiling at me, just him being here.
Her message is the same from Alex's room as it was next to his hospital bed.
A shot is definitely a lot easier than where we are right now.
Mercedes McKay, THV 11 News.
And of course, we wish them well. Let's get to some other news this afternoon. Today, Arkansas Governor Asa Hutchinson met with other state leaders to discuss new maps for the state legislature following the release of the 2020 census data. The group presented 2 maps, one for state senators and another for representatives. There is now a 30-day public comment period ahead of the changes, taking effect. We'll have a closer look at those maps tonight at 5 and 6. President Joe Biden kicked off a 5-day diplomatic trip to Europe today by meeting with Pope Francis. The reunion sets the stage for the G20 summit, which starts tomorrow in Rome. The president's agenda includes issues he's been working on at home, addressing climate and corporate tax changes. G20 leaders are expected to sign off on a global corporate tax rate, with 136 countries agreeing to a minimum 15% tax on corporations.
Countries have lost the ability to gain meaningful revenue from taxing very successful corporations, and more of the burden has been placed on workers.
After the G20 summit this weekend, the president heads to Scotland for the start of the UN Climate Change Conference. United Airlines is set to resume in-flight hard liquor sales next month. Alcoholic drinks will be available for purchase on flights longer than 300 miles. The pandemic prompted many airlines to suspend liquor sales over the summer. United was one of many to limit drink service because of unruly passengers. Some other airlines say they won't resume liquor sales until next year. A new study shows many workers are ditching jobs that can't be done remotely. According to Indeed Hiring Lab, job searches in childcare, food service, and home health have dropped nearly 8% in the last few months. On the flip side, searches for higher-paying remote jobs in IT and help desk roles have surged. It comes as weekly unemployment filings dipped to a new pandemic low last week.